Welcome to B2B Sales Trends, the podcast dedicated to sales leaders in the B2B space, where we share conversations about innovative and successful sales transformations to keep you up to date on the latest trends. This podcast is brought to you by Global Performance Group.
Welcome yet to another fabulous episode of the B2B Sales Trends podcast, my lovely people. The show that brings you hacks, tips, thought leadership to the topic of B2B selling. My name is Harry Kendlbacher, and today's episode is going to be fabulous. Today I have with me Frank Shipp. Frank is the VP of Sales at Cardinal Health. Welcome to the B2B Sales Trends podcast, Frank.
Thank you so much. Great introduction. I love what you're doing over there, and I'm happy to be a part of this. Thank you for the invite.
Absolutely. It's a pleasure to have you, Frank. To kick this off, give us a bit of an intro about yourself. Tell us about your role at Cardinal Health and what kind of sales challenges your teams are facing right now. That would be fabulous.
Yeah, no, absolutely. So as you said, my name is Frank Shipp, and I have been in medical sales for a little over 15 years. You know, I started in pharmaceutical back in the day, and then I went to GE Healthcare, where I got into the capital equipment game. You know, I started in services, then I was an account executive there, and then ultimately I led our ultrasound, general imaging ultrasound business, which was a really fun time. As you said, now I'm at Cardinal Health, and I am the VP of sales for our specialty products business. And you know, right now, the team is just focused on, this is our Q4. So we're focused on selling more. We're trying to close very strong at the end of Q4 and really make an impact with our customers. And this is happening in the midst of tariffs and all the other things that are going on in the world.
Interesting. It certainly is a challenging environment out there right now. And, what sort of challenges do your salespeople face at this stage? End of the quarter, the stuff needs to get done. What sort of challenges do they come across, especially in this environment at the moment?
Yeah, it's truly about prioritization right now. What can move the needle the fastest? What can we do to truly help the customer get from point A to point B? We have all these competing priorities with the business, with the customer. So we truly have to prioritize what's going to be the best move to make to move whatever we're working on, move it further up in the continuum for sure.
Yeah. And healthcare has changed a lot over the years, and and you being very experienced in this. How has buying changed and the decision making in the healthcare space in recent years?
Oh yeah, this is definitely, we could talk all day about this particular subject. So I'll say this, healthcare is evolving extremely fast, right? We have systems are consolidating right now. Budgets are much tighter than they used to be. And decisions are now made from a broader team, versus that one person used to write the check for everything. So I would say what I've seen is traditional product focused selling doesn't work as well anymore. You know, sales teams must shift to a strategic, more insight driven conversation. So I'll say three things that I'm seeing the most. One is consolidation, as I said, and centralized decisions. So deals are decided at the system or the IDN level, and reps have to be able to map and influence cross-functional stakeholders. So that's number one. Number two is truly outcomes over features. Customers want to know how your solution improves their outcomes, not just what it does. And then last, something that we've really seen across the industry is procurement is now key. The financial stakeholders are getting involved much earlier in the sales process. And the sales teams, they have to be fluent in the cost, in value, and in ROI, because these supply chain leaders, they're at the table early on now.
It's interesting. Our research says that anything between 30 and 70% of deal improvement can be made if salespeople engage procurement proactively early in their sales process.
Yes.
But the challenge is that salespeople's perception of the financial stakeholder is, oh, they're going to be a pain in my backside. So I'm going to delay that conversation as long as I can, but they're really passing up that opportunity to dig into that 30 to 70%, increase in deal size. Is that something that you see in terms of salespeople's behaviors towards those financial buyers as well?
No, absolutely. We have to learn to embrace those financial buyers because to some degree they're writing the check, right? So let's start out with the baseline conversation on what's happening. But again, many salespeople don't feel comfortable having that financial outcome conversation. That's something that we as leaders have to really hone in on to make sure that they are prepared to talk the talk.
Yeah. It's really interesting. We do a lot of work in educating salespeople on how to deal with procurement and what part is what KPIs does procurement have? And when you ask salespeople, they think, oh, price and cost reduction and all that is at the top of the list. No, price is, I think, fifth or sixth on the list of priorities. So if I know that and if I understand that, I can choose my talk track very, very different here. It's
Exactly.
really an interesting dynamic. You mentioned that there are many stakeholders involved, right? And our experience is that unfortunately, salespeople tend to often stick to sort of one talk track, right? What does it take to help reps flex their approach in this respect and speak to, we talked about supply chain, but clinician and finance in a way that actually resonates with them?
Uh,
What have you seen in that
Yeah,
respect?
the complex sale, these sales are becoming so much more complex now, and reps have to learn to speak more than, I'll say, one language. Like a single pitch will not resonate across the clinical, the financial, and the operational leaders. So you've nailed that. So success really depends on their ability to tailor value for each audience. So some things that I've seen that we have to do as leaders of organizations is persona training. The rep has to understand each role's priority. So if it's a clinical person, what is that patient outcome that they're looking for? If it's a supply chain person, what is that efficiency or that operational outcome that they're looking for? If it's finance, what is that financial outcome? Something that we have to get back to, and my counterparts and I speak about this a lot, is the art of role play. It's like we're too good for role playing these days. We have to do that a lot more. We have to practice tailoring that same solution for different stakeholders. And there's no better way to do that than stand up in the crowd of your peers and have those role playing conversations, especially in training. And then lastly, we have to truly teach that use discovery first. When I'm going in to speak to Harry, who is the clinical leader or the financial leader, we need to understand the customers or that particular stakeholder's goals so that we can actually shape our message. Many times we come in with this pre-canned message that we're just going to sell whatever it is. And as you said before, it doesn't resonate whatsoever with the person that you're speaking with.
Right. Right, right. It's so critical. We always say that, in nowadays selling environment, it really takes courage for people to get out of their comfort zone and do things differently. But the question is, where does courage come from, right? It's not something that magically falls out of the sky for us, right? But
Right.
courage is really a combination of the skill and the knowledge that I can execute that skill well. So, in other words, the competence plus the
Yes,
confidence to do it right, that will give me the courage then to engage differently. Um,
absolutely.
right.
Absolutely.
You mentioned outcomes, and at a global performance group here, with everything is about outcomes, is really interesting. I'm curious to get your take. When you're selling into these complex healthcare organizations, as you mentioned, it's not enough anymore to talk about features and benefits.
Mhm.
What does it take to lead with outcomes, and how do you help your teams and reps, bring these financial, clinical, operational impact into those kind of conversations?
Yeah, no, that's you're spot on. In today's environment, a good product just isn't enough. In many instances, it's what's good enough, right? But truly expect measurable results. Like sales reps must be able to shift from selling features, as you said, to knowing how their solution drives impact. And that impact is driven by understanding or being able to articulate the financial outcome, the operational outcome, the clinical outcome, as we spoke about before. Now, how do we do that? I think it starts in onboarding with their training, right? We have to start with insights. The rep has to learn to be able to open up sales calls understanding or wanting to understand the system specific pain point. So that's number one. That has to be taught early on in the process. They then have to know how to quantify the impact. So in training, we're using case studies, we're using benchmarks. We teach the reps how to use those ROI calculators in order to be successful. And again, that talk track, how do we align across roles? We have to be able to translate that value in a way that matters to each buyer because everyone has a little different in what they want. And we have to have, I think as an organization, we have to have experts that can come in to help the rep. You know, we can bring in that financial expert. We can bring in that clinical expert to help have those conversations and tee it up with the right person. And then lastly, the art of storytelling. That's something that we don't speak about as much anymore. How can we combine the good data and how can we really create a narrative and a message that is going to stick with the customer? And storytelling does that every time. But many times we don't have time. We want to run in, we want to throw up, we want to put the information out there, and then we leave. Let's take some time, let's position ourselves, let's tell this story about when I worked with, Frank's hospital down the street and the issues that they were having and how I helped them with those challenges. That builds credibility. It also makes you a person, a human to that
Right.
person that's sitting in front of you. So
Right.
yeah.
I really like that. I completely agree with you that storytelling, it's not often not enough used in my opinion. And if it's used, it's not used as well as it could have been. Anyway, I think it's a very strong tool.
Cool.
You mentioned earlier about obviously the uncertain environment at the moment with all the different political pieces that come into that and the current situations and so forth. Now, that has led a lot of businesses to decline win rates. So everybody sort of needs to win more deals, need to win them faster, ideally. And most of the times, or a lot of the time, should I say, the issue is not another competitor. The issue is do nothing. Or stand still. Stay in the status quo in the current situation, not making a decision. One of the things that we always talk about is this idea of having the cost of inaction conversation.
Oh yeah.
Really make sure that we are telling that story of that impact of what it has if you do nothing. It's one of the toughest conversations, in my opinion, and one of the most important ones. In your experience, what helps reps to lean into that conversation more instead of avoiding it?
Yeah. I truly love talking about this because it happens more and more these days. I really think reps avoid this conversation because they think it's too aggressive. Like I'm really jumping on the customer. But when handled with, I'll say with care, discussing the risk of doing nothing can actually drop urgency and position the actual solution where it's needed and it's not optional. You know, I really think to help reps with that, number one is you have to shift the mindset that this is not about pressure. you are helping the customer by making them informed. You're making them informed of what they could do and what's not going to happen. So informed decision is really important. You have to be able to use proof. And again, going back to the storytelling, show real world consequences using data for past examples. So we have to be able to give the customer another view. And we have to reframe the opportunity. It's really not ROI. It's going to highlight what the customer stands by gaining by acting. If we reframe that, we make the customer, we make it a lot easier for us to have those conversations with the customer. And we're just not seeing it now.
It's interesting. There's been a number of stats from a few different research providers out there that say that 80+% of B2B purchase decisions have stalled in the last 12 months. Now that's huge, right? And that cost of inaction conversation coming in is more and more important. I think sometimes the issue is that when people think about the cost of inaction, they confuse it with ROI.
Right.
ROI, in my opinion, and tell me what your view is on this. ROI, in my opinion, is the outcome potentially to create from doing business with us or with you, generally, right? The cost of inaction is really what are the consequences as a whole to you and your organization if you staying still as you currently are. That's my view of things. What do you think about that?
No, I am totally aligned with what you're saying there. If you do nothing, what is it going to cost you?
Right.
It's XYZ. But again, Harry, it goes back to understanding the customer, understanding the outcomes, understanding the industry. Our reps have to be knowledgeable to have that true conversation, for sure. And from a business perspective, I mean, as you said, imagine the funnel, the deals that are there that needs to be pushed through, but the customer isn't moving because whatever's happening right now. We have to be more astute in having that conversation, for sure. I love this conversation.
Yeah. You mentioned outcome driven, and it's interesting. I truly believe that people make decisions one out of two reasons, right? Either to gain an outcome or to avoid a risk. So
Yeah.
for one, you need the outcome-driven conversation. And for the other, you need the cost of inaction conversation, right? It depends the environment, right? But you mentioned now both are very important, obviously. How does this play out with your leaders, with your sales leaders? They're obviously trying to move their teams towards a more strategic, outcome-driven selling approach. What's one shift you think they should be prioritizing from a sales leader or sales manager's perspective with their reps?
Yeah. So I think when we want to make those things stick, right, we have to truly focus on the conversations. Our conversations have to be improved that we're having with the customer. We can't go in and have these tactical selling approaches. We have to lead with insight and speak the customer's language. That's just period. So shifting the priority is really about is about impact versus the activity. Don't just track calls or the slides they're using. We have to coach the outcomes, but we have to really focus on how the reps are moving the deals from point A to point B. And that becomes a more smart rep, I'll say, a data-driven rep, a rep who understands the environment, can go in there and really position the solution as what they need to do today, not tomorrow, today.
Right. Very, very interesting. You mentioned training, and it sounds like it's part of your strategy, which is great. In our experience, training is one thing. Of course, that's important, but making it stick is another, right? What has worked for you when it comes to really embedding these skills and behaviors into how people actually sell in the field?
Yeah, no, that's a good one. So we all know that training sparks new skills, right? But without that reinforcement, those skills will fade very, very fast.
Right.
So the real challenge is, how do we embed those new behaviors into the rep? I think that's what we're all trying to figure out as leaders. So one is truly managing reinforcement. So
Mm.
that first line leader, they have to be trained to coach the right behaviors in the field. So that's why field ROI reports are so important these days when you're out in the field with your reps. Something that we've done is micro coaching. So we're going to focus on your small, consistent habits, right? Like, how do you open a meeting or framing up value statements? Like, those are things that you can practice very quick on calls with your reps when you're out in the field. But then we have to build in accountability as well. So by doing that, we have to tie in the behaviors into rhythms that we already have. So call reviews, team huddles, etc. You know, if you're familiar with CAP, the change acceleration process, GE was really instrumental in bringing that to the forefront. But that's, CAP 101 there. And celebrating those wins, because we want to reinforce that good behavior. So those are things that we can do to truly help those behaviors stick, for sure.
Love it. You clearly not just a senior leader in the space, but also a real thought leader in what you've just shared. So that's great. The last question on every podcast, Frank, what I ask every single guest is, in this changing environment, what, in your opinion, are the top 3 qualities of an elite salesperson? In other words, if you're hiring somebody new, you're hiring for an elite level rep, what are the top 3 things you think they need to be excellent at to battle this nowadays, all these challenges that they have?
No, that's great. One is problem solving. They have to
Mm,
have the ability to look at the issues that are facing the particular customer, those environmental challenges, and be able to sit down and truly solve that problem through speaking with the customer and being able to pull in individual stakeholders internally that can help them with that. So that's
mm,
that's number one. Two is data driven. Look, we say we have to get away from features and benefits, and we look at outcomes. This new age rep or this great rep needs to be data driven. They need to be able to dice and slice that data up and make it tell a story for the customer. And then the one thing that we can't get enough of is truly having a rep with grit. All this
right.
other stuff is icing on the cake, but the baseline, the spirit, the soul of that rep has to have grit, where he or she is going to go out there and they're going to make it happen no matter what. So again, it's grit, it's the ability to problem solve, and it's someone who really understands data.
Uh, I love the last 20-ish minutes, however long this took today. Thank you, Frank. I know our listeners will super, super appreciate your insights, your thought leadership. So thank you for taking the time. It was fabulous.
No, Harry, thank you for the invite. You're doing something great here, and I'm glad I could be a part of this movement. Thank you so much.
Thank you. 2 calls to actions, my lovely people. Go to the b2bsalestrends.com site to share this episode or other episodes with people who you think would benefit for us. Subscribe to our B2B Sales Trends podcast channel on YouTube. That would be sensationally appreciated. Until the next time, my lovely people, look after yourself, after your loved ones, and of course, your B2B customers. Bye-bye.